The New York Times conducted a video where they asked people from other countries with nationalized healthcare systems to compare their own healthcare system to the one that we have here in the U.S. The video is about 6 minutes long. It's rather lengthy, but I encourage you to watch the whole thing because it's quite astounding.
If healthcare is a constitutional right, then
that's a form of communism because no country could afford those payments without seizing the assets of everybody else.
Welcome to Finland!
Oh!
Dudes, what's going on? Oh my god!
It's making me so mad.
I mean, come on, guys. It's not that hard. Look around the world. Everyone else seems to have figured it out, right? Imagine you're in America. Which of these options would be best for you?
That's a lot to think about.
What is it? An OOP max?
I guess with what I got here, I would go with Plan D because the deductible is 0.
Okay, there's more.
Gold, HMO, PPO, HMO.
And what are copays? I don't get... That's like if you pay for Spotify Premium and Spotify still makes you pay every time you listen to a song.
It's too complicated.
I'm lost. I'm so lost.
In Canada, I don't have to really think about the different plans that I could pick from.
You just pay one amount per month and all the major treatments are covered.
At least 70% of our medical expenses are always covered.
Uninsured, unable to afford treatment for a tooth infection that keeps flaring up. Cook Emma Rittner lost her job in March.
I did manage to get antibiotics from a friend whose mom regularly goes down to Mexico, and I've been taking that, self-medicating, based off of Dr. Google's advice.
Dr. Google's advice.
Here in Japan, even if you lose a job, you would never lose your health insurance.
When you lose your job, that's when society should help you.
I've chosen a creative job and had the backing of a healthcare system. But if you don't have that, do you pick the safe job or do you pick the creative job?
The average price per unit for insulin in 2018.
Germany, $11.
Canada's $12. Wow. It's like 8 times the price of insulin in Canada. I guess that explains why Americans come up to Canada to buy medication.
I'm sorry, hold on. So the FDA doesn't have any authority over the prices?
We have also privatized health insurance companies in Germany, but the prices are regulated by the government.
The government negotiates the prices and fixes that price for 2 years.
In Singapore, they regulate this stuff to keep the prices down and, avoid like this happening.
Right, so I'm looking at an American medical bill.
Why is it so expensive?
$428,000 for rooms and such empty spaces. What?
Much cheaper to go Hilton Hotel than this one.
Skin to skin after C-section is $39.
I had to pay $39.35 to hold my baby after he was born. You need to pay money to hold a baby?
My brother Jamie, who's in a lot of our videos, was pretty badly injured. He's going to lose a couple fingers. If you can give $1 or if you can give $5, every little bit will help him and his family.
That's heartbreaking.
GoFundMe should not be something that people have to resort to pay for their medical bills.
So in America, people spend more than twice as much as in Japan for healthcare.
If I paid twice the amount for a car, I would want the car to be twice as good.
So what's the life expectancy in the US?
Why is it less?
The US should be on top of both of those lists. Like, if you're charging your citizens that much money, then they better be living the longest lives. It doesn't make sense.
When Alec turned 26, he was no longer allowed on his mother's insurance plan. Instead, he decided to pay for his insulin over the counter at list price. But the pharmacist told him a month's supply would be $1,300. He left empty-handed. Alec's official cause of death was diabetic ketoacidosis.
A couple of years ago, I developed a heart condition, and I had to have my heart restarted 3 times. After the 3rd time I had it restarted, the doctor suggested I get heart surgery.
When I was 13, I started to get sick, and really, really sick. I was then very quickly admitted into hospital, where after 3 weeks, I had treatment for a brain virus.
The cost of the operation, I think, is about $60,000. And then the next day, when I left the hospital and I got my bill, it was a bill for parking. It was about $30.
And was treated by royal doctors, had several MRIs, lumbar punctures, all for free.
So I was pretty happy that I lived in Canada and had universal health care.
I couldn't have survived if I was in America.
To know that I can get sick, I can get injured, but I will still be taken care of. That is freedom. This is not freedom.
Now, videos like this aren't new. They've been done in the past. I've watched them, but I am always amazed at the reactions. Why, you ask? Because they're always the same. These people from these other countries with universal healthcare systems are always confused, befuddled, and alarmed at the inadequacy of the US healthcare system. And I mean, it's something that we've been talking about for a very long time, and it's something that needs to be fixed. And this problem, in my opinion, should be at the forefront of issues when it comes to the left and what we're pushing for. Because the country, by and large, are pretty much united on this issue. Now, on other issues, there may be, the line may be drawn right through the middle, or other issues may be less popular. But on the issue of healthcare, at the very least, the country is aware and knowledgeable that they are being fucked. And we need to take advantage of that, okay? So they start out by asking these people, what healthcare plan would you choose? Which one would you choose between these 4? And they don't even know. Like, they don't even understand what's being presented before them. Like that one person said, what is an OOP max? Referring to the out-of-pocket max. Because they don't have that where they're from. They don't pay out of pocket. They don't have that. They're not being screwed the way we are over here. What are co-pays? What are deductibles? They don't understand that shit. And the one person says, man, this is too complicated. And she's completely right. The issue of healthcare doesn't have to be complicated. In fact, it's not complicated. You need help, you get help. Free at the point of service, paid for through tax dollars, publicly funded. That's how this should be. That's how the best healthcare systems operate. In the UK, they have a nationalized healthcare service. I think that's actually what it's called, the NHS. Literally everything over there is nationalized. And in many studies, they are shown to have the best healthcare system. I mean, it's empirical evidence. But for some reason, the politicians over here have somehow been trying to convince us for the longest that that doesn't work, and that's socialism and communism, and it actually lessens your freedom. No, that actually gives you more freedom to be able to go to the doctor and get help, whatever doctor you want to. They spew endless lies and propaganda to try to undermine things like Medicare for all, things that the left supports. But that's all it is lies and propaganda. How can you lie about something that every other country has, and it's empirically shown to be better than what we have? I mean, it's quite astonishing that they even attempt to do such a thing. That one woman says at least 70% of medical expenses are covered in the country that she's from. At least 70%. Imagine that reality here in the US. And they were also talking about how, we have employer-based healthcare in this country. So half of Americans have healthcare through their employer. And they were talking about how when you lose your job, you lose your healthcare. And that one guy says that when you lose your job, that's when society should help you. Think about what he just said. See, here in America, we have this teaching where when something bad happens to you, when you lose your job or anything of that effect, it's your fault. You did that. And you have to pull yourself up by your bootstraps and get yourself together. No government handouts. Government shouldn't help you. You know, don't ask what your government can do for you. Ask what you should do for what you can do for your government. That's bullshit. That's completely bullshit. And every other country, every other developed country shows it. When you lose your job, that's when society should help you. And since we're talking about employer-based healthcare, if we had a universal healthcare system, it would actually save the employer money because they wouldn't have to pay for their employees' healthcare. So they would actually save money as a result of that. They also talk about how their respective governments negotiates for lower drug prices on behalf of the citizens. We don't do that here. There's this provision where the federal government can't negotiate with Big Pharma for lower drug prices. And that's unique to America. And so what happens? Big Pharma, they want to make their profit, of course, because they're profit driven. And so they price gouge here in America because they know that whatever they say we pay, we pay. And that's what happens. And people go bankrupt every single year. Tens of millions of Americans don't have health care or have inadequate health care right now at this very moment. 15 million Americans lost their health care under Donald Trump before the pandemic. 45,000 to 60,000 people die every year from lack of health care or inadequate health care. 1 in 3 GoFundMe campaigns are geared towards raising money for medical costs. Explain how this is our reality and people think it's okay. This should be the forefront of every single lefty's, band of issues. Universal health care, Medicare for all, because the people are by and large united on this issue. It's like the march on Occupy Wall Street, the 1% versus the 99%. Things like that, universal programs unite people because people feel like, okay, we're all in this together. This includes me. I'll support it. That's how you win. And then when you win, you bring upon the other issues that you can argue for that may not be as popular as the one that you just won on. But that's how you do it. And our politicians, our representative politicians, don't seem to understand that quite yet. But I hope one day they do. We pay the most for healthcare. We have the worst healthcare outcomes. We have the lowest life expectancy on average out of all the developed countries. There's absolutely no reason for this. There's no reason for this other than corruption and money in politics. Big Pharma, the health insurance companies, they give loads of cash to each individual party. The Republicans and the Democrats, they take a lot of money from these big industries. That one girl started to tear up hearing the story of the guy that, didn't have the money to purchase insulin, so he died. I'm sorry to break it to you, but that's not the only story of this happening. I mean, that occurs all throughout this country every single year because people don't have the money to pay for their medicine. And the Canadian guy points out that, a lot of Americans, that's why they go to Canada to buy their insulin because it's cheaper there. The Canadian guy, his story, he was talking about how he had his heart restarted 3 times and then they finally decided that he's going to need heart surgery. And he said that the heart surgery cost about $60,000. And when it was all said and done, they gave him a bill. It wasn't for $60,000 though. It was for parking. Could you imagine getting heart surgery here in America and then getting a bill? Not for how much the heart surgery costs, but for parking? Yeah, me neither. The one woman said she literally couldn't survive here in America. And to top it off, that one guy said, I can get sick and be taken care of. That is freedom. And he's exactly right. Freedom can only be realized after life's basic needs are met. So make sure everybody has health care. Make sure everybody has access to a higher education and that they don't be thrown into debt. Don't plague the future labor force with spiraling debt that they'll never be able to pay back for pursuing a higher education. Give everybody a wage that they can live on and attain adequate subsistence in order to live prosperous lives. How would you feel if you knew that your tax dollars were going to fund health care for everybody? How would you feel if you knew that your tax dollars were going to give the future labor force a higher education? How would you feel if your tax dollars were going to a place that would provide for society the needs that they require in order to live prosperous lives? Because, that's not really what's happening. Our tax dollars are going to bombs that are going to be dropped in Baghdad to kill some innocent family of 5. This is what we deal with. But once again, America is the laughingstock of the world in terms of the healthcare system. People from other countries just can't seem to grasp how bad we're being screwed here.